Aortic stenosis is stenosis of the aortic valve. The aortic valve is actually a major valve of the heart. It separates the left ventricle from the aorta, which is a great vessel that provides blood flow to the rest of your body. So when you have aortic stenosis, you have a buildup of calcium in that aortic valve, and it obstructs flow. So when you have an obstruction, you can't have decent flow from the left ventricle to the aorta, so that could be a problem and cause a lot of symptoms. Symptoms can be chest pain, shortness of breath, or actually syncope, feeling like you're going to pass out. So when you have aortic stenosis, there are several treatment options. First of all, if it's mild severity in stenosis, it's something that can be watched. Moderate to severe with symptoms, you have to consider having something surgical done. So when you have symptoms, the natural history of that is that there's a 2-year survival. So if you start developing chest pain or shortness of breath or syncope, anything associated with that aortic stenosis, your chance of survival is about 50% in 2 years. So it's recommended that you have surgery at that time. The diagnosis of aortic stenosis is made with an echo, which is an ultrasound of the heart. The ultrasound of the heart looks at the heart ventricular function, but as well as all the valves, to include the aortic valve. Once you're told by your cardiologist that you have aortic stenosis and you require surgery, that's when we see you for surgery. Aortic valve replacement is the operation that we do for aortic stenosis, and it's done with the heart-lung machine. Essentially what we do is we make an incision through the breastbone and put you on the heart-lung machine in order for the heart-lung machine to take the function of the heart, and lung to arrest the heart, and then we open up the aorta, take out the diseased valve, and put a new valve in. And the options of valves are tissue valves versus mechanical valves. So that's a basic operation: to put you on the heart-lung machine, open up the breastbone, open up the aorta, take the diseased valve out, put a new valve in. There are minimally invasive approaches to aortic valve replacement, and that is a sternotomy, a hemisternotomy. Instead of having the full sternum open from the sternal notch down to the xiphoid, only half the sternum is open. The operation is essentially the same. It's a different cannulation for the heart-lung machine, but essentially a smaller operation and theoretically less pain and less blood transfusions and length of stay in the hospital. The other approach, actually minimally invasive, is through a right thoracotomy, making an incision through the rib, in between the ribs, to access the aortic valve that way as well. All these minimally invasive aortic valve replacement procedures are done by CTSA. So the risk for aortic valve replacement, in general, it's a very low-risk operation. For somebody who doesn't have a lot of comorbidities, the risk of operative mortality is probably less than 2%. So a very good chance that you would have a pretty successful operation for aortic valve replacement.